Hello, my name is Aisana and I'm the clinical lead for eSurgery. Welcome to our eHealth Matters podcast. Today, I'm introducing co-founder of eSurgery, Dr. Oskar Wenbar. Hello, Oskar. How are you today?
Hello, Aisana. Very well, thank you. Thanks for having me on the podcast. I'm very excited. So my name is Oskar. I have a PhD in medical research, and I'm also a registered pharmacist. My area of interest is actually studying the role of hormones on aging, and I've published several articles on this as well.
Amazing. It's great to have an expert to shed some light on a very popular topic, which is TRT. So let's start by, what is TRT?
Yeah, sure. So TRT stands for Testosterone Replacement Therapy.
Mm-hmm.
So that means putting external testosterone into someone's body. So that could be in the form of tablets, it can be in the form of injections, or most commonly, it's going to be in the form of a gel. The gel is applied on the skin, usually in the morning. Now, I think we do need to make the distinction between testosterone replacement, which is putting external testosterone into someone's body, and testosterone boosters, because this is a question that we get quite often. And what I mean by that is, if you go on Google, for example, and you type in testosterone, you're going to get a lot of herbal products, and you're going to get a lot of supplements. So there's a ton of herbal products that claim to boost your testosterone, and there's also pharmaceutical prescription drugs that do so. Now, I think people need to realize that the herbal products, while they might work, don't have the same amount of clinical evidence behind them as the prescription medication. So things like HCG and anti-estrogens have been proven conclusively that they're going to increase testosterone.
That's really interesting. So from what my understanding, what you're trying to say is that it's not so much that these herbal products are proven that's going to add anything to your testosterone levels. They're not replacing your testosterone, but it is going to enhance your existing testosterone release levels.
Potentially. So they work through various ways, and there are some studies, but the problem is they're quite small.
Mm-hmm.
And the issue with herbal products is they're not actually standardized. So a lot of these products aren't, at least. So you don't really know exactly what you might be getting, and you don't know whether it's actually going to be working. It's always best, if you actually think that you might have an issue, to get your testosterone checked and then go with a product that we know is going to work for sure. And we know the side effect profile, and we know if it's not going to interact with any other medications you're taking, which is another issue with herbal products.
Absolutely. So for the purpose of this podcast, we are just going to focus on the testosterone replacement therapy, which is the prescription-only medication usually prescribed by a clinician. So not what you buy off the internet. Yeah. So is low testosterone common in men? To my understanding, it would be the older you get, the lower your testosterone levels will be. It's a very hard word to pronounce.
Yeah. So that's true. And what a lot of people don't realize, it actually starts quite early. Mm-hmm. So at the age of 25 is when we see conclusively that your testosterone levels will go down. Mm-hmm. And this is pretty much a linear drop. So if we could get a graph up, I can kind of show you, or the viewers, exactly what that looks like. Between the ages of 30 and 40 is when we see the most steepest decline. Right. So a man that's 35, for instance, is going to have about 76% of what they would normally have in terms of testosterone when they were 25. Now, that doesn't mean that they're necessarily going to see any symptoms of low testosterone, but it certainly means that they do have less in their bloodstream.
And how would that be presented? Would they experience symptoms?
Yes. So if someone that does actually get symptoms, the most common symptoms would be sexual symptoms. So things like erectile dysfunction and low sex drive.
Okay.
So one of the earliest signs, or kind of earliest ways to tell, is morning erections. Mm-hmm. So what happens with testosterone, if you look at a graph during the day, the peak generally happens in the morning. And basically that's why men get erections. They wake up with an erection in the morning. Now, if that's something that's normal for you, and then all of a sudden you're seeing less and less of that, that's a pretty good sign that your testosterone levels are dropping.
And I suppose it's fair to say that, if, for example, if you're experiencing difficulties with maintaining an erection is not necessarily to do with the testosterone. So always do follow up with your general practitioner, because there could be a variety of different conditions that could be contributing to that.
No, absolutely. So a lot of people come into forums, or they go to a doctor and say, okay, I think I might have low testosterone. But in reality, they have a very bad diet. They drink a lot. They don't go to the gym. They don't exercise enough. And then think that this is going to be, a magic solution. But the reality is that those things, the healthy lifestyle things that you need to do, need to come before that. So whenever you're diagnosing someone with low testosterone, they need to get those basics in line. So they need to make sure that they're having a healthy lifestyle, which is they're going to be having 150 minutes of moderate exercise or 75 minutes of high intensity exercise every week. Their diet is going to be good. They're not going to consume a lot of alcohol, and they're not going to smoke.
Yeah.
Okay. So if you have those things in order, it's kind of like low hanging fruit, really.
Yeah.
Then you can go ahead and get your testosterone checked.
Okay. Which brings us to our next question. How do we do that? So let's say I'm a male patient and I do everything right in terms of the kind of lifestyle measures, and I still am experiencing symptoms. What would be the next steps?
Yes. So what we want to do is what's called a venous blood test. So basically we're taking blood from a vein. It's not something like a finger prick one. The issue is that the finger prick blood tests, they've proven to be unreliable. So when you want to diagnose someone, we want to be 100% sure that this person has low testosterone. So whenever anyone asks, I would recommend, go get a venous blood test. You can get a phlebotomist and get that done. And that's something that's gonna contain your whole hormone profile.
Yeah.
So we want to see things like testosterone, free testosterone, luteinizing hormone, follicle stimulating hormone, and estrogen.
Yes.
And we also want to look at your cholesterol, and we want to look at your liver values as well, and generally a full blood count. So we want to have a whole picture of what's going on, really, before that clinician can make that decision.
Absolutely. No, that's really, really useful. I'm sure a lot of, as you said, you come across, you type in Google, you go into lots of different forums, or in my cases, there's so many situations where I've been into the gym and I could just hear very young men, talking to each other about, oh yeah, I just did a finger blood test and, I have a low testosterone. And they kind of just almost prescribe testosterone for each other within a gym setting, which is definitely not advisable. So please, if you do have symptoms, we cannot emphasize on the fact that you do need to go and see a clinician, have a full blood test, as Oskar mentioned, and to make sure that you establish a diagnosis before taking any sort of treatment.
No, absolutely. No, I completely agree with you. And I think there's this stigma as well with testosterone replacement therapy, connecting it to bodybuilding and abuse.
Yep.
Which really is not the case. Because what we're doing is, we're giving someone a gel that's going to bring their testosterone levels within the normal range. If you look at the blood levels for a bodybuilder, for instance, they might have 10 times the normal testosterone. Okay. And that testosterone might not be the natural hormone. It might actually be synthetic anabolic steroids as well, which are much more powerful. So it's completely different. And yes, the stigma, and I think it's something that we need to change and kind of have a different view about testosterone replacement therapy.
This is really interesting because, and I know this is not the topic that we're talking about. However, going back maybe 10, 20 years, I feel like we were here for female HRTs.
Yeah.
And I'm sure you would agree with me, there's been a lot of awareness around female hormone replacement therapy. And I feel like that's where we are. And hopefully from this podcast onwards, we will be raising awareness about how important and under-recognized and under-diagnosed this whole field of male testosterone levels have been as well. So hopefully we could...
Absolutely. So when we were looking at some of the data on this, we were seeing that there were 13 million female HRT prescriptions issued just last year alone. So that's actually serving 2.6 million patients. Now that's a whole lot. But the amount of actual people on the TRT, of men on TRT, is not even 1% of that. And when we're looking at some of the studies, we see that the prevalence of TRT, or low testosterone, is actually quite high. It's a lot higher than we think. So in men over the age of 45, the study's showing that up to 40% of men are below the normal threshold, and they should be on therapy. So when I did the maths on this the other day, actually, so when you work out the demographics, it was just over 5 million patients, and that's just men over the age of 45.
Oh, wow.
That would actually should be on TRT. And it's interesting that we don't treat them because of this whole stigma around, okay, we shouldn't be using testosterone. But in reality, there was actually another study that showed that by doing so this was an economic study, basically saying, okay, if we treat these people, or how much money are we going to save? And it was about $3,000 per patient per year that we would save the NHS if we treated these patients with TRT.
And what is that?
Yeah, and that's because you're reducing weight. So there's a lot of health risks associated with weight. Okay. And we're also improving mental health.
Oh, wow.
So these two massive things that a lot of men struggle with.
That's really true. There's a lot of issues that it's not spoken about as well.
Yeah, absolutely.
So especially with mental health, there's a whole, again, stigma that men don't tend to speak about it, and it kind of just spirals.
Exactly. And I think you have to consider the fact that, especially with the sexual side effects, if someone has erectile dysfunction, if they have really low sex drive, it's not going to translate to very good mental health. If someone's got erectile dysfunction, not going to be a very happy person. Mm-hmm. So it's something that can be tackled, but should be tackled more.
Absolutely. And I do in my day-to-day practice as well, I come across many scenarios with a lot of patients as well, where they kind of voice that they don't feel comfortable talking about this with their family members or even with their GP. I know that our GP is as a family friend as well. So I suppose, just if you don't feel comfortable with the regular GP that you have, please don't feel like you can't reach out to someone else. So there's a vast amount of help.
Absolutely. And I think the problem is, or a big part of the problem is, that GPs simply don't have the kind of expertise that's needed to initiate therapy, or kind of know exactly what the levels should be. Yeah. And it's funny that you mentioned this. So I was in America not too long ago, and we just had kind of a meeting with a few men. We were about between the ages of 35 and 40. And then we were just saying, which one of you guys is on TRT? And almost half the guys there, out of 10 men said, yeah, I'm a TRT. And I think that's something that you just wouldn't see in this country, because one, not a lot of people know it's available. And two, because of that stigma, a lot of people are embarrassed. They're going to think that people are going to judge them because they're on TRT.
Yeah. And at the end of the day, it is, again, another, would you call it, it's an illness? Would you categorize it as an illness?
This is really interesting. When I was doing my research, and there's this whole push for how do we view aging? And a lot of people don't view aging as a disease or a disease state. So a lot of GPs will try to say, well, you've got erectile dysfunction, but it's kind of normal because you're getting old.
Yeah.
Well, is it, or should we consider that kind of something that we can treat? If we have the means and the treatment that's available, it's something that we should be treating, because ultimately it's going to improve someone's mental health. It's going to reduce their chances of cardiovascular events, and it's going to improve their quality of life.
Okay, this sounds all amazing, and thank you so much for all the information you provided. Right, so Oskar, there's a big question about who is it not suitable for? So who cannot take TRT treatment?
So the first thing that comes to mind for me is men that really want to have children. Mm-hmm. So we're going again into this concept of fertility. When you give someone external testosterone, basically reduces their sperm production. Now, a lot of the studies actually show that that's reversible, but not 100% of the cases. So if that's a priority for someone, I would say don't start TRT. okay, it's safer for you to take something like a testosterone booster, like HCG.
Yeah.
That's going to increase your testosterone up to a certain extent, and it's going to increase your fertility. So that would be the better option for those men. Okay. Now, I do want to get this right. So people with certain blood disorders, prostate and breast cancer, cardiac or liver disease also shouldn't be taking TRT. If they have a history of clots, strokes, heart attacks, or very high cholesterol, it's a big danger sign to a clinician.
Okay.
It's not necessarily a no-no, but it means that that's going to be a decision between that clinician and the patient. Everything is obviously going to be a risk and benefit scenario. You gotta have to weigh the risks versus the benefits, right? Absolutely. I mean, even with things like contraceptive pill, it's going to increase your chances of certain strokes, cardiovascular events, or cancers, but it's going to give you another benefit. So this is a discussion that needs to be had with the clinician.
Okay.
The other thing is men that don't like doing blood tests. When you're on TRT, you're going to have to get, a venous test, and you're going to have routine tests just to make sure that we're having a look at what your bloods are looking like. As we said before, testosterone can increase red blood cells, which can actually then put you at higher risk of strokes and heart attacks.
Is it because it makes it more sticky, your blood?
Essentially, yeah. Yeah, okay. To put it simply, yeah.
Yeah.
So, I mean, personally, I don't like needles as well.
Of course.
But it's just something that you have to overcome. Yeah. If you want to be on TRT, it's just part of that. Okay. So, unfortunately, if you're not going to be doing regular blood tests, you really shouldn't be looking at TRT. Okay,
so I have a question here. And with the monitoring that's required with testosterone therapy, does it have to be a venous, so draw blood from, or can they just do it like a finger prick test?
The initial diagnosis should be a venous blood test, because you want to make sure that you're actually keeping them in that range.
Absolutely. And you on the optimum dose that, because there's not one fits all. There's different types. Absolutely. So I think it's really worth mentioning as well that don't listen to, Tom down at the gym. And I'm sorry that I keep going back to the gym. It has to come from a healthcare professional. And it's really, really important that, you don't say, oh, my friend just told me to do 2 pumps of testosterone on my arm.
Yeah, without any testing.
Testing.
It's this like gym bro mentality.
Absolutely. Yeah. So it really does have to be based on your blood test results and appropriate dosage.
Yeah, absolutely. I mean, and just going back to the testing as well, not only for the testosterone replacement therapy, if you're testing regularly, if there's something wrong with your blood, you're going to stay on top of that much sooner. So testing regularly is actually a really healthy thing for you to be doing anyway. Okay,
that's good to know. If you like needles, that is.
Yeah, if you like.
And if you don't like it, just stick to the bare minimum.
To be honest, we are getting some saliva tests as well now, and the finger prick blood tests really aren't that invasive. I've done one the other day; it wasn't too bad. Okay.
That's amazing.
So yeah.
Oh, I bet you're gonna love the saliva test, though.
Yeah, saliva test must be.
Watch this space. For the saliva testing, of course. And just going back to the blood test as well, is there a specific range that the patient needs to be aware of to qualify for low testosterone treatment?
So this is an interesting topic when you talk about, what's the actual threshold. The normal range typically is between 8 and 30 nanomolar. It depends on the lab. And the problem is when you do a lab test, they give you a range, but that range typically doesn't take age into account. Some labs do now actually say, okay, you're within this age range, but most don't. So the normal standard is 12. So if you're below 12, that typically means that you're going to qualify for testosterone replacement therapy. But we have to remember that it's symptoms and blood test. So if someone is showing symptoms of low testosterone and having a low testosterone level, that is when you treat. If they're not showing any symptoms, typically it's not something that you would treat.
And just to add to that as well, other condition must be rolled out before they go ahead with the treatment with TRT.
Yeah, what do you mean by other conditions?
So by other conditions, so let's say if they're having erectile dysfunction and they are borderline on, let's say the blood test comes back as 12, and there is no other factors for the erectile dysfunction to explain it, then testosterone could be an explanation and treatment will be appropriate for that.
Yeah, exactly. But most clinicians will say, get the lifestyle factors in place before you come and get the blood test. Once you have the blood test, you're going to make a decision. If something's borderline, if you're just over 12, for instance, you might have to rerun the test. The thing with testosterone is quite variable. So you get like peak in the morning and then it just drops. So you want to make sure that you've got an accurate assessment. We're taking that blood test and we're making sure testosterone replacement is a commitment, right? Okay. So when you start testosterone, it's something that's going to be long term, right? And you're going to be doing the testing and you're going to be, taking that medication for a long time. So before we make that decision of saying, oh, you've got low testosterone, that diagnosis, we really have to be sure.
I see. Okay. And could you explain a little bit more about the commitment? So if you're seeking this privately as well, there's also the financial commitment to it.
Oh,
the monitoring and, just following through with the treatment, the compliance with the treatment as well. So what is it? Is it a long term? You have to take it for many, many years. What happens if you suddenly stop it? Tell us more about that.
So we have to consider the fact that if you're taking testosterone, your body wants to stay in a state of balance, of equilibrium. Right?
Yeah.
So if we're putting in external testosterone and your body's going to say, okay, well, we've got enough of that. I'm going to make even less of this natural testosterone. Okay. So as you can imagine, if you just abruptly stop, you're going to be in a worse position than you started. So you're going to have even lower testosterone than before, which means that your symptoms are going to come back, potentially even worse. And it's just not going to be a healthy position.
I see.
So it's something that tends to be reversible. So it means, you can come off testosterone replacement therapy, but it really shouldn't be done abruptly. Okay. And when it's done, it's normally done long term. And I'm talking years and years and years.
I see. Okay. So have that discussion with your clinician before you start committing to it.
Absolutely. So people just need to know what they're getting into. They need to know the side effects and they need to know the implications of doing something long-term to your body. And of course, the financial implications, it's not particularly cheap either.
Of course, absolutely. You mentioned it yourself, side effects. So as we know, there's no medication out there. Even paracetamol has like the longest list of side effects. So tell us more about what to expect initially or long-term in terms of long-term side effects.
Yeah, absolutely. So I like you said, I took a box of ibuprofen the other day and I was looking at the side effects and I'm like 20 different side effects there. So with any medication, anything that you're putting into your body can have side effects. Mm-hmm. The thing is though, testosterone is something that you normally have in your body for men anyway, or women as well, but much less. So putting in a natural hormone into your body is not the same as putting a foreign pharmaceutical in. So in theory, it's actually not as dangerous. Okay. There are side effects, of course, and generally we see those side effects in bodybuilders. You have aggression, you have oily skin, you've got high blood pressure, increased cholesterol in the bloodstream. Those are things that you generally see in bodybuilders because they've taken those 10 times the amounts. Typically, you don't really see that in people just on TRT. Okay. The things that you do have to be mindful of are the red blood cell count, as we said before. Yeah. So this is why testosterone is used in doping, right? In cycling and swimming, etc. What it does is increase your red blood cell count. That means you're going to have stronger endurance. The problem is increasing red blood cell count also puts you at a risk of stroke, heart attack. It makes your blood stickier, as you said. So that's something that definitely you need to keep an eye on. The other thing that I do want to mention as well, people that are genetically prone to hair loss.
Okay.
You're putting in testosterone, that's going to convert into DHT,
right?
Which is an even stronger anabolic, and then that's going to actually potentially make you lose your hair faster. So it's one of those things that people should probably consider taking anti-androgen like finasteride when they're taking testosterone therapy if they're prone to it genetically, if they have a family history of baldness, etc.
It's really, really important. Okay. And in terms of the lifestyle support that is required for TRT, what would you recommend? We briefly touched upon making those lifestyle changes before we start TRT.
Yeah.
But what do we do after we've initiated the treatment?
So it's very much the same as what you do before. That healthy lifestyle that you should be leading should be going after the testosterone as well. It's not a magical treatment. Taking your testosterone levels to normal levels is not going to make you all of a sudden get very muscular. It's not going to make you someone like Ronnie Coleman or Jay Cutler. I'm not if you know who that is.
No idea.
Viewers will probably know. It's not going to make you a bodybuilder, right? It's just not a magic solution. So what you still need to do is make sure you're getting the exercise in. Go to the gym. You should be doing some weight training.
Yeah.
Make sure you eat a balanced diet. You shouldn't be eating too much fat. That can increase your cholesterol with testosterone therapy. And you need to make sure that you're not drinking too much alcohol and you're not smoking as well. So this is normal routine stuff. Right?
Of course, absolutely, for any healthy lifestyle, which I'm sure we have been banging on about in every episode that we've done so far.
Yeah, exactly.
Absolutely. So, Oskar, what are the treatment options out there for patients?
Typically, we're talking a gel. So it's a topical formulation, or we have injections or tablets. So I'll show you, I've actually brought one of these. So this is one of the kind of most common gels. And what you do here is you get a little pump dispenser. And what happens is every morning you wake up, you do 2 pumps of this, put it on the shoulders, this area here.
Yeah.
And that's it. So very easy to use, very kind of user-friendly.
Amazing. And that is also available in sachet forms as well?
So sachet forms, if you're traveling, for instance, are quite handy, and you could use that as a sachet as well.
Okay, amazing. Probably not the injections for yourself.
The injections are more common in the States. The injections kind of are only used if you need to use more testosterone rather than the gels. If someone, for example, has small children as well, you don't want them actually touching that gel. You don't want to have them to have access. The injections can be done. They don't have to be done every day. So you can do them less frequently as well. So for some people, it works better.
That's actually a really good point. I didn't even think about, I know I have young children. They're constantly, crawling all over me. If I was to use a topical treatment, that wouldn't be good.
Yeah, exactly. So you have to be very careful. If you're using a gel, just make sure you keep that away from children and any women as well. We shouldn't be touching that.
Of course. Would that be specifically pregnant women, childbearing women?
Yes, exactly. If someone's pregnant, they specifically don't want to be, taking external testosterone. So you want to make sure you're putting that in a safe place away from anyone.
Okay. And how long does it take to absorb into your skin till it's safe to touch?
It's very, usually very quick. So when you put that on about, 10, 15 minutes, and then you just put, your shirt on and go about your day. Okay. So after that, it's not really going to be an issue. It's quite sticky. So the problem is if you're putting it on your hands, you really want to wash your hands very thoroughly because you'd be surprised how sticky it is and how much residue will remain on there. So you don't want to be putting it on, not washing your hands, and then, handing your children.
Of course.
So that's one thing to keep in mind.
Okay, that's really, really useful to know. Thank you for that. And are there any other formulations that are available other than the most convenient one, which is the pump dispensers?
There's, like I said, we talked about the injections. So you can have the injections. They're a bit less common, but they certainly are out there. There was a gel, so kind of soft gel. The problem is when you're taking testosterone internally, it's not really as effective. It gets broken down in your stomach, basically. So they're not really that effective. There's also what's really exciting, actually, a nasal spray coming out. It's coming out, I think it's come out in America, but it's making its way to the UK. So that's an interesting solution as well. Okay,
because it's obviously just going systematically in your bloodstream rather than having
it's bypassing your stomach and your hepatic metabolism. So it's going straight into the bloodstream, which is quite cool.
That sounds really exciting. And how long does it take for these treatments to start working?
So steroids are, the way that they work anyway, is they're actually supposed to go into the cell nucleus. So they have to go to the cell wall and into the cell nucleus. It takes a while.
Okay.
So to see the full effect of steroids, it's on a basis of days and weeks. So normally between 1 and 2 weeks before you start noticing the benefits.
I see. Okay. And what about the long-term benefits from it?
So the long-term benefits are really interesting, and this is kind of what my research was based on. So
it should be good.
Yeah,
I'm
exactly.
get comfortable now.
So when you take testosterone for a certain amount of time, it starts affecting your skeletal muscle. When we talk about skeletal muscle, it's your muscle that kind of makes you move, right?
Right.
And when you do that, when you look at the structure of a skeletal muscle, it's very different. Their muscle cells are really cool, and this is some nerdy stuff. But basically, they're a long strand. They have multiple nuclei, unlike most other cells. And they will have what's called satellite cells. So on the kind of on the cell membrane, you have these cells, and they're really interesting because they're stem cells.
Okay.
So what happens is they kind of go into action when the muscle is damaged. Now, different people have different amounts of satellite cells. But what we do know is when you take testosterone, those satellite cell levels go up. And we can actually see, a little diagram. You can see the difference between a normal muscle cell and that has testosterone. You can see a lot more satellite cells there. And the important thing is when you age, you're going to keep those satellite cells.
Okay.
So what happens is a lot of elderly people develop what's called sarcopenia, and that means kind of a degeneration of muscle.
Yep.
And this leads to, problem with movement. It makes them less active, and it creates a lesser quality of life. When you have more satellite cells in your elderly years, it means that you're going to be able to regenerate that muscle, and you're going to be able to stay mobile for longer. And this is something that we really studied quite thoroughly, and it's really exciting. And that's kind of the benefit of taking testosterone, because ultimately, aside from the immediate benefits, you're gonna see that benefit when you get older. So you're gonna be able to stay active. You're gonna be able to do things for longer, and that I think is really important because your quality of life is gonna be extended.
That is really powerful stuff. Thank you for that. And I'm a little bit jealous because I feel like I also need testosterone not to get old. Is there such a thing for females as well?
Well, it's funny because, females have much lower levels of testosterone. But as you know, there's also the kind of the move to give them small amounts. And this is mostly for, sexual benefits, I think, having
like a low libido.
Increased sex drive and things like that. But certainly, because the females have a much higher sensitivity to testosterone. So you don't actually have to give them a whole lot. Even that small amount, in theory, should be giving you the same benefits as a man with, much larger doses.
Of course, that's really interesting. It still affects the satellite cells as well in both genders. That's really interesting. So, Oskar, is weight gain a big symptom of low testosterone in men?
Yes. So weight gain is one of the first signs that someone might be having low testosterone. Mm-hmm. And it's actually a really interesting phenomenon. So what happens is when your testosterone levels go down, your weight gain goes up, your fat gain goes up. And what happens is in the fat tissue, testosterone is converted more into estrogen. Right. So you're going to have more estrogen in your body and even less testosterone. Wow, okay. So you see what's happening. So what's really happening is that this vicious cycle of you having low testosterone, gaining more weight, and then having even lower testosterone.
Yeah, I see what you mean. Yeah.
So eventually what happens is you're going to get what's called metabolic syndrome. And then you're going to have a higher risk of diabetes, type 2 diabetes. Right. You're going to have a higher chance of heart attack and strokes. And ultimately, it's also going to affect your mental health as well, because you're going to see a lot of people that I speak to, they say, I'm eating the same that I have. Mm-hmm. I'm still exercising, and I'm not gaining muscle, and I'm gaining a lot of fat. My waist size is increasing, and what's happening here? And what's happening is they're decreasing in testosterone, and they're kind of starting this cycle.
Right.
And it's something that's very unhealthy, actually, because it means that people are less active. Right. They're having a higher chance of all these cardiovascular events. And it's something that can be easily reversed if you have the testosterone therapy. Before
they develop complications such as heart disease or stroke.
Yes, exactly. And that's kind of why we talked about the benefits, right? Yeah. So we said, it's actually really beneficial for people to have the right, and I'm talking about people that have low testosterone here.
Yeah.
So if you fix that, then you can kind of turn this cycle off. You can go back to them being in a much healthier weight, and that's really important. As you know, people, like, in general, being overweight is very, very unhealthy.
Absolutely, yeah. And then I just never thought about the vicious cycle of low testosterone and then increase in estrogen.
Yes, it's really interesting. Yeah, so what happens in fat tissue is actually that testosterone is converted, is what we say aromatized into estrogen. So inevitably, a person that is heavier has higher estrogen levels as well.
Okay.
Which just kind of plays back into kind of the need for blood tests as well. Because if you have someone that started on a high weight and then all of a sudden they're getting on testosterone and they also have high estrogen, we'd like to see that estrogen drop.
Okay. So completely random question that just came into my mind as well. And I'm only saying this because we've been doing the Mounjaro podcast, and I don't want to shed light on your expertise in terms of testosterone. But someone, for example, who is struggling with their weight and they have done the blood test with the low testosterone, would they still be able to use weight loss treatments alongside testosterone?
That's an interesting question. Again, when we talk about testosterone, it's not a foreign drug. So so the difference between someone having 12 nanomolar and 25 nanomolar, it's not like they're having a different drug. So there wouldn't be a different interaction when you're taking, for example, a weight loss treatment.
I see. Okay.
I think it's still important to make sure you're doing the bloods.
Yeah.
And make sure, because I know with some of the weight loss treatments, it can affect some of your blood. So I would make sure, you're still staying on top of that. Okay. But the thing is, obviously, the weight loss treatments have their own contraindications.
Of course.
So always have to be sure that you're actually looking at those as well.
Of course. Oh, thank you so much for that, because I didn't really want to bring up another episode into this, but I mean, it is health and it is all kind of related to each other. So it's also good to be mindful whether someone who's struggling with their weight, if it is to do with testosterone, can benefit from a helping hand from another medication. So
yes, exactly. And I think it's just making sure that we're doing things systematically, making sure that someone has got the healthy lifestyle in place, then they've got the testosterone levels corrected.
Yeah.
Then at that point, are they still struggling with weight? Do we need to then add another? If we don't need to, if all it is a matter of correcting diet and going to the gym, and that we should definitely go that route. Yeah. And then after that, we can consider other treatment.
Of course, absolutely. And we have been referring a lot in this episode to going to the gym as well.
Okay.
So just to clarify, you don't need to go to the gym as long as you are exercising according to the NHS standards. Yeah, I know. I've probably said this so many times through this whole episode as well. Just go to the gym.
Yeah, of course. I mean,
just be active.
The guidance again is, what is it? 150 minutes moderate exercise a week.
Yeah.
You can do that, jogging outside. It doesn't necessarily, it doesn't necessarily have to be in a gym. Yeah. The reason I say that is because testosterone replacement, you can get that benefit, that muscle benefit, if you're also adding weightlifting as well.
Of course.
So, 2 or 3 times a week, weightlifting gives you a benefit to the skeletal muscle.
Okay, to just strengthen the muscles.
Yeah, and when you have a higher amount of lean muscle, that means your base metabolic rate actually goes up, which means it's going to be easier for you to stay a healthy weight.
Thank you for sharing that.
Yeah, all right.
Absolutely learned so much every time I have anyone on the guest, but this was super interesting. Thank you so much.
No, it's very exciting. Thank you. Hopefully everyone will get, a benefit from this. And, we didn't really go into much kind of very specific things, but I think that's kind of by design. Yeah. But if anyone wants to ask more specific questions, hopefully we'll get some questions in the comments that we can answer.
Yeah, no, that would be absolutely amazing. If anyone's got any questions, please reach out, and I'm sure Oskar would be thrilled to answer those questions.
Yeah, absolutely. If I can, I'll try.
Yes, thank you so much, Oskar. It really has been very interesting to learn so much about testosterone, not something that I have a lot of knowledge about when it comes to the science. I know all about the prescribing of it, but not so much the detailed science and what happens into anatomy of.
But it's been really fun. Thank you.
Oh,
you should definitely do it again.
100%. Absolutely. This brings us to the end of the podcast. Thank you for joining us. And once again, thank you, Oskar.
Thank you very much.